Is removal of the wisdom teeth straightforward, or is it different to normal extractions?
Well, it depends. When it comes down to the extraction of the wisdom teeth, if it's parallel and it's visible like the rest of your teeth, or normal pulling out of the teeth by a general dentist, it's an absolutely straightforward procedure. But mostly that's not the case with the wisdom teeth. And if they're giving you trouble, they are somewhere seated deep down into your bony structure. So a surgical extraction is mostly planned for the wisdom tooth extraction by the oral surgeon. So the first appointment, they will assess your situation. Second appointment, they might discuss the options with you. They take your x-rays, they show you how far deep your wisdom teeth are. And in many cases, when they do the surgical extraction, you're given the option whether it's done under LA. LA is local anesthesia, with some conscious sedation where you're put down to sleep, but you're not completely sleeping, but you're kind of aware, but you can control those sensations easily under conscious sedation. Or it can be done under GA, which is general anesthesia. Because the funny thing about wisdom teeth is if you're having problem on one side of your jaw with your wisdom tooth, you will have the problem on the other side of the jaw. They kind of play the same game. So mostly if your dentist recommends you to have an extraction by the oral surgeon, and if it's planned under general anesthesia, try and get your both the wisdom teeth extracted in one go, because we know there could be a problem in future. The downtime for the extraction of the wisdom teeth could be slightly longer than a normal extraction, so it's important that you speak to your dentist about that. But mostly the removal of the wisdom teeth is slightly tricky and it's not as straightforward as a normal tooth extraction, so the right planning is important.
Are there any risks of wisdom teeth removal?
Well, mostly the wisdom teeth extractions are surgical extraction because they are impacted, they are seated in your jaw. So it's not really easy for the dentist to have a direct access for the tooth removal like a normal pulling out of the tooth. So they do have to undergo the removal of the bony structure which is covering your impacted wisdom tooth in order to remove the wisdom tooth. So there are certain risks associated. The short-term risks are some pain, swelling, bruising, inability to eat your food properly for a couple of days, which is quite normal, and that is going to resolve within no time, and which can also happen by any extraction, to be honest, in general. But with the wisdom teeth in particular, if your extraction was traumatic, or the dentist had to spend a lot of time removal of the bone and then having access to your wisdom tooth, sometimes you end up having a very particular problem with the wisdom tooth, what we call as a dry socket, which only happens in 5% of the cases, because the blood clot formation after the extraction is very important. So if the extraction was traumatic, or if somebody had diabetes or somebody is a smoker, that blood clot formation could not happen in a natural way, which can expose the underlying bony structure, which means that becomes susceptible to infection. So if you get a sudden bout of pain 3 to 5 days later after your wisdom tooth extraction, mainly in the lower jaw, it's important you go and see your dentist, because you might need some dressing to cover your exposed bone, which is leading to the pain. It is mostly associated with some very bad breath and a bad taste in your mouth. So it's an indication that you need to see your dentist again. Another thing with the wisdom teeth, which is also a small risk, is the damage to the nerve, because mostly the wisdom teeth are deep seated in the bone, and that's exactly from where the inferior alveolar nerve travels. This is a nerve which is responsible for the sensation in the lower half of the jaw. So if any damage happens to that nerve while the dentist is removing your wisdom tooth, there can be a temporary loss of sensation or a burning or a tingling sensation in the lower jaw. Or sometimes you feel, I can't feel my chin. Usually this sense recovers on its own within weeks' time, probably 3 to 4 weeks' time, by the healing of the nerve. But if there is a permanent damage to the nerve, there can be a permanent loss of sensation. Again, this is a very small chance of this happening to you while the wisdom tooth extraction, because mostly the wisdom teeth extraction are planned. So the dentist who's doing the job is very well aware that where is the location of the wisdom tooth and where is your inferior alveolar nerve. But it's always good to discuss with your dentist the risks associated. Sometimes they decide to leave a small piece of the wisdom tooth which is closest to the nerve, just for the protection purpose. But mostly the recovery time is a little longer. So 2 to 3 weeks is the normal recovery time from the wisdom tooth extraction, if that was a surgical extraction. And you might need to take a few days off work, like 3-4 days, in order to heal properly and just to look after yourself. So it can be slightly difficult to handle when it comes to the wisdom teeth extraction.